In the last part of Chapter 17 on sudden illnesses, we're going to continue with certain things that could come up suddenly and how we can treat them. In the other videos, we have discussed a lot of things having to do with heart attack and stroke and diabetes. Now we're going to look more at some type of abdominal complaints. So any type of gastrointestinal problems, people may have a sudden sharp pain, or it could be a dull pain in the abdomen. They may have nausea and vomiting, or diarrhea and constipation. And the abdomen is the area between the diaphragm and the groin. There are different organs. The stomach and intestines are hollow organs, and the liver, spleen, and gallbladder are solid organs. So what to look for when somebody has abdominal pain? Ask them, when did the pain start? Where is it located? Is it constant? Do you have gas or burping to, help relieve the pain? Do you feel nauseous? Is there diarrhea or vomiting? Also, see if the person feels warm. Do they have, anybody with them that has similar symptoms? Is there a chance that they're pregnant? Is the abdomen rigid to the touch? And if you notice that they do have pain, try to give them fluids, try an antacid, place a hot water bottle against the abdomen, be prepared for them to vomit and keep them in a comfortable position. You need to seek medical care if the pain is constant and severe, if they're not able to drink fluids, if they may be pregnant, if the abdomen is rigid, painful, and swollen. And more pain occurs after you press your fingers on the person's abdomen and then suddenly release. If there's bloody or blood-stained vomit or stool, that's a reason to seek medical help. If they have a fever, and if the pain began around the belly and later moved to the lower right part of the abdomen. Nausea and vomiting can occur suddenly, and that could be due to motion sickness, brain injury, altitude sickness, intestinal viruses, eating or drinking too much, or being emotionally upset. What you're looking for is if there's abdominal pain with the vomiting. Is there a bloody or grainy material in the vomit? Is there diarrhea associated? Are there signs of dehydration? Does anyone with them have similar symptoms? And has the person had a recent head injury? What you should do is give them a small amount of fluids, offer a carbohydrate, have them rest and avoid exertion, and position them on their side. Seek medical care if there's bloody or grainy material in the vomit, if there's constant abdominal pain, if they faint when they're standing up, if they're unable to keep fluids down for more than 24 hours, and if they have severe projectile vomiting, and also if it follows a head injury. Motion sickness is another thing to look out for. Usually when someone is motion sick, they suffer from nausea, pale skin, they may get the cold sweats, they may vomit, have dizziness, headache, and fatigue. You want to sit if somebody does, have some type of motion sickness, try to sit them in the midsection of a plane, boat, bus, train, or car, rather than completely up front or in the back, far back. Don't let them read, have them look ahead, and avoid overeating. Diarrhea is another common sudden illness that can occur, and you have the passage of loose, watery, unformed stools. Problem is dehydration can occur when someone has diarrhea, so you need to replace fluids and electrolytes. So specifically Pedialyte or a Gatorade has electrolytes that can help replace that. Let diarrhea run its course is usually the best course of action. But what you should look for is, was the person exposed to untreated or contaminated water or food? Is there blood or mucus in the stool? Are they dehydrated? Are they having severe abdominal cramps and pain? Do they have an issue with losing the bowel control? Are they feverish? And does anyone else have similar symptoms? What you can do is have the person drink a lot of clear fluids, give mild food. Bismuth can help. It may turn the stool or tongue black. People who are sensitive to aspirin should not use this. You can also look for certain things and notice that if somebody is having bloody stools, then they need to seek medical care. Or if there's no improvement after 24 hours, if they have a fever and have severe constant abdominal pain and they're severely dehydrated, you need to seek medical care immediately. Constipation is another mild issue that can occur suddenly, and sometimes people have very hard or dry stools, and it could be a result from their diet, their fluid intake or lack thereof, whether or not they're active, and what their emotional state is. So look for bloating sensation in the abdomen and hard or dry stools. People should have, regular bowel movements. I know of a woman that has severe constipation where sometimes she doesn't have a bowel movement in 2 weeks. This is not a normal scenario, and it causes her stomach to be very distended and very bloated. So what you can do is try to eat more fiber and drink plenty of liquids. Especially when you're increasing fiber, you want to have more fluids. Otherwise, you can have more bulk to the stool. Encourage a person to stay active. And if there's no improvement, you can try a stool softener, and sometimes caffeine will stimulate bowel movements. Seek medical care if there's severe abdominal pain or of swelling in the abdomen, fever, and vomiting. So that's the end of chapter 17, what to do for sudden illnesses. Lots of things can come on suddenly and quickly, and being prepared and knowing what to do, questions to ask, and how to treat is the best scenario for anybody that's trying to offer first aid care.